اوكي واضح slide. Yeah. Like my task today is just to give you a quick clinical orientation about the atherosclerotic cardiovascular diseases. I'm sure my other colleagues they are going to cover most of the like the basic science behind it from the physiology and the pathophysiology. But my goal today, inshallah, just to show you what and how these people present. So more of, inshallah, it will be more of like an early clinical session. I will also show you some cases on how we diagnose and treat patient with coronary angiography if they present with different forms of coronary artery disease, spectrum, and acute coronary syndrome. So I will not really spend a lot of time talking about the physiology and the pathology. I'm just going, as I said, I'm going to focus mainly on the clinical aspect, how these people present, and just to give you, try to link what you know about the pathophysiology of atherosclerosis to the clinical presentation of the patient, and also how do you investigate these people, how do you treat them based on the pathophysiology these people have. By the way, if anyone has any question, please stop me anytime, okay? Feel free to interrupt. Prevalence of coronary artery disease in the kingdom here and most Middle East countries very quite high compared to the Western population. Just imagine let me ask you this question. Is coronary artery disease coronary artery disease, is it a disease of the young or elderly? We talk about male and female. يلا إجابة كذا منكم.
Both.
Is it a disease of the young? خلينا نتكلم, we'll take it by gender, all right? So male. So first of all, if you compare male to females, who is at higher risk of having coronary artery disease? Males or females?
Male.
Why?
Males.
Male. Correct. صح. Why?
Estrogen have a protective effect.
Yes, exactly. So the effect of the hormones, that's why they are protected against most atherosclerotic diseases. Like, الآن خلاص. So we know now males are predominantly more affected than females. Like, خليني أسألكم, the second question is, what is the average age of patients presenting with, خلينا نقول, acute myocardial infarction in the Western population?
ممكن بالفورتي.
40. طيب زميلتكم تقول 40. في أحد يزود أو ينقص؟ احنا we talk about healthy people, average in the Western population. Like, what's their average age to have a first myocardial infarction or acute coronary syndrome? زميلتكم تقول 40s. طيب أحد عنده other opinion, any other different opinion, different number?
Maybe after 65.
Yes, exactly. In the Western population, most of the first-time presenters with acute coronary syndrome or atherosclerotic event, it's usually at the age of definitely above the age of 60, right? Why? Because this is when we see we are going to talk about the risk factors for atherosclerosis, and one of the biggest risk factor is age by itself. Allah musta'an, the older we become, the more and the greater at risk we will be for having or developing atherosclerosis in the future. All right. So that's why the average age depends on the countries, but most of the Western countries that you'll be around talking about or looking at roughly early 60s to mid 60s the first time or presentation of first or acute coronary syndrome. طيب خليني in the Middle East، بلاش نتكلم في السعودية هنا مثلا. In the Middle East, in India, Pakistan, most Middle East countries, تتوقع what is the average؟ عشان we see how what is the population here, are they different from the West or not? أعطوني رقم كذا.
80
70 ممكن
70
80
80 لا, it is much younger than the overall age of myocardial infarction in the Western population. All right. Our people here, average heart rate, age of patients with acute myocardial infarction, based on some registries that looked at that, and it was in the mid 50s to late 50s. فتخيلوا إنه we are having we are 10 years, our people here develop atherosclerosis, coronary artery disease. لكم تتخيلوا 10 years or 15 years younger than what happens in the people in the Western population. طيب السؤال why we are at greater risk? What do you think? الجواب from this table in
الدايت.
yes. So yeah, so it's Allah musta'an because of the life that we have. The lifestyle is miserable. Just imagine that the prevalence of risk factors for coronary artery disease, as shown here in this table. Diabetes is almost 25%, hypertension 26%. Smoking now it's almost close to 20% if we combine male and female. 50% of the prevalence of hyperlipidemia is 50%, and obesity is around that. So that's why we see atherosclerosis, more severe form of atherosclerosis, and Allah musta'an, we see it in the younger people in our population. So now, quickly, anatomy and the layers of the arteries. I'm sure you know this more than me. We just basically divide them into three main layers. So the intima, the media, and the adventitia. Right. So this is as we go from in all the way out. All right. So what is the layer that is in direct contact with the cells and the blood and the circulation? What do we call it?
intima.
Intima, exactly. Which structure in the intima in particular? وش نسميه?
endothelium.
Yes, absolutely. All right. And the media, and then after that the adventitia. All right. So this is the layer. This is the inside of the artery, and this is the endothelium. All right. And this is the media and the adventitia. So So the area the media here is mostly consists of smooth muscle, and that's why we and they are very critical in the process of atherosclerosis that I will be talking about. The elastic and the adventitia, which is the outermost layer of the artery, is the one that we basically feel when when we perform the physical examination. So when we look, we, for example, teach you how to feel the artery, look for the rigidity, hardening of the vessel, calcium. This is basically what you are going to feel in the adventitia. So endothelium, for us as a cardiologist, we consider it the most precious organ and the most precious structure in our body. يعني هذا يا جماعة الأورجن endothelium هو أغلى ما يملكه الإنسان. يعني depends طبعا إنه each doctor الله المستعان بيكون متعصب للسبيشالتي حقته، حقون البلمونري والنيورولوجي each one might decide what organ. لكن يعني تخيلوا إنه يعني Allah created this structure, the endothelium, to prolong our life. تعرفوا what is the function quickly سريعا كده of the endothelium؟ يلا throw any functions سريعا. The biggest function of the endothelium, what does it do?
Exchange of gases.
Okay, غيره.
Diffusion of
the most important function يا جماعة, the most important function.
اللي هو تبادل الغازات.
لا okay, yes it is. لكن يا جماعة that is what protect the arteries from all the nasty toxins and the bad chemicals in the blood. The endothelium is the one that protects the arteries from all these toxins. And the second thing also the endothelium does اللي هو it where the process of the healing of the thrombus or the clotting start as well. All right, so it's important for the protection of the arteries, and important also for bleeding and for controlling the bleed. All right, plus the other thing that you talked about. So quickly, the process of atherosclerosis, how does it happen? So again, quickly, I'm not going to spend a lot of time. This is the bloodstream that you see here, all right, and this is the endothelium, and then we have the media where the muscles are, and then the outer surface or the outer layer of the adventitia. All right, so first of all, the process of atherosclerosis starts from inside the artery, and then it invades the artery until it occupies most of the wall of the artery. All right. What is so يعني دحين now if I want to ask you about atherosclerosis, what are the important steps that you have or the patient should have to develop atherosclerosis? What are the items that they have to be there for atherosclerosis to happen? إيش رأيكم؟ أبغى أسمع منكم. I don't want to.
High lipid levels. High lipid levels.
Like, first of all, you have to have the chemicals or the substances that are toxic and they are going to irritate or invade the blood vessels. ممتاز. So what are these chemicals? ايش هي تتوقعوا؟ Exactly lipids. ممتاز. غيره Are there any other chemicals?
There is cytokines and macrophages.
Right. Yes. So if there is a lot of inflammation, all these inflammation, the process of inflammatory cells, all right, they are these cells also play a major role in the development of atherosclerosis. ممتاز. What other substances مثلا or other problems? خلينا نقول smoking مثلا, all right, smoking's all the toxins, all right, they tend to also irritate and those with مثلا cocaine as well, all right. So any abnormal chemical, all right, that can damage the artery, so the atherosclerosis, number one, first of all, has to the patient should have a high or abnormal levels of these chemicals in his blood. No, otherwise, if someone has absolutely no harmful substances, أنا كده أبغى أقول لكم هي بطريقة very lay and very simple. If a patient does not have any bad substances or chemicals, the patient is not going to have atherosclerosis. All right. But this is number one. So number one, there has to be chemicals in the blood that are going to invade and attack the blood vessels. ممتاز. وقلنا أهمها lipids. All right. What else has to be the second step in the process of atherosclerosis? خلاص الآن we have these chemicals, substances موجودة. What else has to happen? So
Fibers.
Fibers. Be specific. ايش اللاير هذه اللي هنا؟
fibrous cap.
Formation of fibrous cap.
قبل الفايبرس كاب يا جماعة الاندوثيليوم. الاندوثيليوم. alright. احنا قلنا الاندوثيليوم, what is the function of the endothelium? قلنا it is the barrier that protects the artery from all the bad chemicals that are going to invade. فإذا هنا step of atherosclerosis, there has to be what we call endothelial injury. All right. So the endothelial is going to be damaged. All right. So can you give me some causes or some problems that can damage the endothelium? Something clinical, يعني. Like what?
Smoking. Inflammation.
Yes, smoking damage endothelium. Yes, inflammation damage the endothelium. What else? Hypertension. تعرفوا الهايبرتنشن يعني تعرفوا انا يعني عشان بس ابسط الموضوع, تعرفوا الهايبرتنشن انا لما اشرح للمريض البروسيس حق الاثيروسكلروسيس, تعرفوا الدريل هذا اللي يحفر في الشوارع, اللي يكسر الشوارع يستخدموه في الأرصفة, هذا هو الهايبرتنشن. يعني تخيلوا الهايبرتنشن high pressure against the walls of the heart والendothelial طول اليوم قاعد شيء يخبطه زي الدريل, ف it is going to be damaged. It's not going to survive. Diabetes, زي ما قلت, smoking, inflammations, and so on. Drugs also, there are some drugs that can damage the endothelium. خلاص, فخلاص إذا this protected layer is not there anymore. What happens بعد كده إيش يصير? Lipid is going to invade the wall of the artery. All right. So the body is going to recognize this invasion. The body is going to do what? في عندي هجوم الآن داخل من الليبيدز. What is the first response to this?
Inflammatory cells.
Inflammation, yes, exactly. Body is going to recognize this as an attack. هجوم اقتحام. All right, so it's going to create an inflammation. All right, so and the most important inflammatory cells that going to eat and fight with these lipid particles are the macrophages, and they form what we call the foam cells, right, which is like the macrophage that basically engulfs the lipid particles. Okay, so more and more of the inflammation happens. What happens to the wall of the artery? More inflammation. With inflammation, with time, what happens? Yes, so the muscles are going to proliferate, and then after that, more inflammation is going to end with what? Most of the الانفلاميشنز تتذكروا وش يقولوا لكم الزملاء في one of the finding or اللي هي late complications of inflammation ايش يصير؟
Smooth muscle will create a seal.
Calcifications, all right. خلاص, nothing worse than the calcification. We'll be showing you some examples of this. Come on. So this is every time when you see patient with atherosclerotic event, myocardial infarction, angina, or so on, please, you have to address these three problems: toxins in the blood, endothelial function and dysfunction, and inflammation and the smooth muscle proliferation, followed by the calcification and the narrowing of the vessel. طيب الآن احنا عندنا this is what the normal coronary artery looks like. All right, so this is the atherosclerotic vessel. هذه هي when the lipid invade the arteries, inflammation happens, and then smooth muscle proliferate, and then calcium happens. So the blood vessel is going to be very narrowed here. All right. طيب. Now with time, all right. So now روحوا للسلايد أو البيكتشر هذه الثانية. All right. So there is some inflammation. So some invasion, foam cells, بدأ الانفلامation macrophages. بعد كده more proliferation. طيب. What happens to the الآن خلينا هنا يصير مثلا عندنا. All right. So شايفين this is what we call the atheromatous plaque. All right. If a piece of an atheromatous plaque dislodged, خلاص لأنه with time, with more hypertension, يصير في crack for any reason, and it dislodged. What will happen in this artery?
It would be occulated.
With what?
With blood.
Blood.
Thrombus.
Yes. So that area that now became exposed to the blood circulation. أول what are the cells that are going immediately to attack this hole and invade it? إيش هي؟
Platelets.
ممتاز. Perfect. Platelets كلهم يجمعوا بعض. They call each other, and then what happens after that? A platelet with
Clot formation.
mumtaz, and this is what the thrombus is going to cause. And if the thrombus is so big that is going to occlude the artery, a patient is going to have myocardial infarction. فإذا كل هذا السبيكترم that we are going to talk about it إن شاء الله very shortly. على فكرة هي المحاضرة مدتها كم معلش أحد يذكرني؟ ساعة. ممتاز. إن شاء الله we will finish. So again, this is quickly the arteries of the heart. All right. So the left coronary artery, the right coronary artery. Okay, and you just need to know this blood supply, how do they of each wall, and the localization and the walls that are supplied by each one. And this is mainly when we talk about the ECG, the localization of the ECG, it tells us where the blockage is. All right, so again, oxygen, how, so as you know, the myocardial cell do not survive without oxygen, all right? Not like the other cells. So the without oxygen, unfortunately, myocardial cell will never last, okay? So that's why دائما تسمعوا دائما وابدا time is muscle in acute myocardial infarction. That is correct, لأنه without perfusion, without establishing blood flow, oxygen is not going to reach the myocardial, the myocytes. They die. They are one of the very fastest, they are the fastest خلينا نقول cells which die and become necrosed compared to the other structures or other muscles if there is a lack of blood supply. Okay. So electricity of the heart, again, you have to know this. Each one is responsible about it's basically the depolarization, the repolarization, everything. The conduction system start from the SA node, which is in the right atrium, and I'm sure you know the pathway and the trouble of the electricity. This is important because of the ECG, that inshallah in the next few years you will have a lot of knowledge about it and how do you deal with it, how do you read it. So the most important things that you probably need to know right now is like what are the waves that we see in the ECG. So the three main parts of the ECG are the waves that you see is the P wave, the QRS, and the T wave. So the P wave is basically it represents atrial depolarization, QRS ventricular depolarization, and the T wave and what is in between this and after that represent the ventricular repolarization. Risk factors. خلاص الآن ما شاء الله عندكم good orientation about these risk factors. So we have the modifiable and non-modifiable group risk factors. So non-modifiable, age, gender, and the family history. What do we mean by family history, by the way? Anyone knows what we mean by family history?
إذا وراثي أو لا.
Yes, exactly. Like, well, and I want you the question is, how do you define what we call premature atherosclerosis history? احنا دائما وابدا when we ask about history, inshallah, we'll teach you in the next few years. We ask about get the family history. So one of the items in the family history you're going to ask about is what we call the premature atherosclerosis. This premature atherosclerotic event is basically what is going to tell us about these people with genetic predisposition and familial, like the atherosclerosis that runs in the family. All right. So, and then we have the modifiable, the smoking, the stress, the high lipids, obesity, hypertension, and we talked that these people, these may, of course, either increase the toxins in the blood and or damage the endothelial part of the arteries. So how people with coronary artery disease, how do they present? يعني سبحان الله the presentation of coronary artery disease varies significantly. خلينا let's start with the basic and probably the most understandable part of the presentation. Sudden cardiac death. Anyone has an idea what is this condition? أكيد سمعتوا عنه. إيش هو؟ عبارة عن إيش؟ يعني إيش؟ sudden cardiac death. إيش؟ إذا تسمعوا عنها الله المستعان إنه والله واحد كان نام. يا سلام عليك بالضبط. مع الأسف واحد نام في السرير مع الأسف صحي متوفى. alright. واحد كان ماشي وفجأة drop dead. تمام. واحد كان يلعب مثلا كورة ويلعب كورة اللي في الملاعب هذه مثلا و they drop dead. alright. This is one of the features of one of the presentation alright of coronary artery disease. إيش العلاقة؟ تعرف أحد يقدر يقول لي ليش؟ Why? Is it because of يعني the blockage of the artery? Does it cause the death? And if so, how does it cause this death?
ممكن تكون في مشكلة في القلب أكثر من مرض بس يكون asymptomatic فما يكتشفه فبعدين تصير له complication واحدة منها إنه يصير في sudden death.
إيه ممتاز. بس إيش الشيء اللي راح يخلي البيشنت dies؟
ممكن البلد سبلاي ما يوصل
إذا
increase
ممتاز.
demand.
إيه ما في blood. The blood ما وصل للمايوكارديال cells. So the myocardial cells, what is going to happen to the myocardial cells? They are not going. أول شيء, the first thing, what is going to happen to the electricity to the heart? لما الآن. Yes, exactly. Yes, exactly. Arrhythmias, exactly. ليش arrhythmias? ليش people with acute myocardial infarction they have what we call arrhythmias? لأنه these arrhythmia happen لأنه why سبحان الله arrhythmias happen لأنه the area that does not reach or doesn't lack the blood يعني that is lacking the blood supply تقعد تطلع تسحب electricity من كل الأماكن. alright. فتحس يصير the heart is very excitable. alright. فيكون وهذه you will understand it more in the ECG إن شاء الله why we see ST elevation. It's just because the excitability of the myocardial cells. So these people might develop malignant arrhythmias like ventricular fibrillation, all right, or ventricular tachycardia, and they die because of it. All right, like acute coronary syndrome. This is like a spectrum when we see people with ST elevation MI, unstable angina, and non-ST elevation MI. راح نتكلم عنها سريعا. And we have what we call stable angina. Heart failure can be one of the manifestation. كيف أحد يقدر يقول لي إنه manifestation of coronary artery disease heart failure? Anyone knows how? كيف? So these people, they do not present with angina. They present with heart failure. Why, first of all? And who are the people might have this? These people do not present with angina. They present with heart failure, i.e., so they complain from dyspnea, from orthopnea, lower limb edema. So most of their presentation is heart failure. ليش؟
ممكن لأنه second stage يعني.
All right. So maybe because they did not feel the مثلا or they did not seek help for the anginal pain. يعني the patient maybe developed acute anterior wall myocardial infarction. All right. Did not seek help. خلاص, that wall is dead. So that wall is dead. It's not going to contract. So the patient is going to have heart failure. فهذه هي البيشنت they present with heart failure simply just because they did not seek help when they presented with the first attack of acute coronary syndrome or ST elevation, for example. And now we deal with the complication. All right. طيب في عندنا another famous people. طيب can is خلينا أنا أقول لكم بسريع يعني are there a group of people who might have angina without pain or ischemic pain without angina without pain? i.e. they might have ischemic myocardial cells without pain. الجواب yes. من هم؟ Who are the people who have problems with the nerves? They have a disease that might damage most of their sensory nerves. فبالتالي they have numbness. They might have numbness. They lose sensation in the legs, in the hands. من هم؟ Diabetic patient يا جماعة. Diabetic patient, all right? That is a complication of diabetes. It kills the nerves, all right? So these people do not feel or do not have the normal pain that people with angina are going to present with. So, and this takes us immediately to the anginal pain. And the best thing that I want to show it to you immediately is yes. So this picture. So this picture, it basically tells you what anginal pain is. Like, so first of all, where do you think the localization of this anginal pain? إيش رأيكم؟
The left shoulders and neck.
لا أول مرة نتكلم على السايت. Where is the pain, the left of the chest pain?
In the chest.
region.
ممتاز. في اليسار حاط يده ولا في اليمين حاط يده ولا في اليسار جهة القلب هنا؟
يسار.
يا جماعة حرام عليكم، هذا يسار. اليد هنا فين محطوطة؟
في النص.
Yes, exactly. So this is retrosternal chest pain or mid or central chest pain. All right. ما هو حاط يده في الجهة اليسار. دائما وأبدا this is exactly what myocardial infarction or angina pain is. It will never be in the left side. المريض اللي طبعا احنا نتكلم commonly, all right. لكن so people when they have left-sided chest pain, this is very unlikely to be anginal pain. All right, it is usually in the retrosternal chest pain. Where does it radiate? زي ما قالت زميلتكم, it can be to the left shoulder, تمام. Jaw, neck might also radiate to the right shoulder, and also it may radiate to the right and left shoulder at the same time. تمام. Patient is short of breath. تمام. Sweaty, cold, calmy. شايفين العرق كذا يخرج منه. Why you think these people might have sweating and why they might have also nausea and vomiting? ليش تتوقع؟ الجواب vagal.
Because of sympathetic system.
Parasympathetic قصدك. Parasympathetic, yes, exactly. Vagal nerve. All right, so whenever the vagus nerve is stimulated, it causes all of these associated symptoms. So these are the features present. The pain by itself, the retrosternal feels like a pressure pain, tightness. تحس المريض يقول لك إنه شيء جالس على صدري. All right, so something is sitting on my chest. It's not sharp. It is not stabbing pain. It is a pressure pain. All right. And this is one of the features. How do you characterize it? طيب احنا قلنا the spectrum of acute coronary syndrome or the process of atherosclerosis. All right. نبدأ من هنا 1 مثلا إلى 6. All right. So 1 is normal. 2 there might be some mild atheroma deposition lipid attached to the endothelium. بعدها there is going to be some atherosclerosis and narrowing. Like people here with narrowing of the vessel, we are going to present with what we call anginal pain. All right. So anginal pain is what is a retrosternal chest pain that is exertional and relieved by rest or nitroglycerin. Like, then retrosternal, why? Because this is where the pain of the heart should be. Why it's exertional, يا جماعة? Why it's not at rest? من البداية. Why in the beginning it has to be exertional? ليش؟
Because there is an increased demand on the heart.
Absolutely. لأنه الhuman is not going to narrow 100% all of a sudden. تمام؟ It's going to increase in diameter gradually. فكل ما زاد الdiameter, all right, the more the blood or the less the blood that is going to be delivered to the myocardial cell. All right. So that's why until so patient is going to have exertional angina. طيب البيشنت يقول والله أنا عندي ألم في الصدر في النص له يجي مع المجهود وإذا مشيت ويخف. طيب تمام. الآن كل كم يجيك يقول والله كل مرة في الأسبوع. تمام. يجلس قديش؟ يجلس والله 3 دقيقة دقيقتين ويروح. تمام. تغير عليك شيء؟ لا والله زي ما هو من 6 شهور إلى الآن زي ما هو نفس الطريقة. يجيني مرة في الأسبوع مرة مرتين يجلس 3 دقائق دقيقتين ويخف ويروح. هذا المريض تخيلوا جاكم بعد 2 شهرين في العيادة. الآن يقول لك دكتور ترى أنا صاير معايا ألم كل يوم. يجلس لمدة 2 3 دقائق وصرت مع أي حركة يصير معايا الألم. إيش الفرق ما بين الاثنين يا جماعة؟ أو إيش اللي صار مع هذا البيشنت؟
decrease من اليومن.
ممتاز. واحدة فيهم إنه والله مع الأسف the narrowing is more. تمام؟ or إيش الشيء اللي ممكن يصير معه؟
formation of thrombus.
يا سلام عليك. Yes, exactly. Or and there might be now this is the progressive narrowing or ما لها يعني ما لها إلا هذه واحدة من الاثنين. يا إنه it is the narrowing قاعد يزيد or there is something that is obliterating the flow. ما في. وبالتالي هي يا thrombus أو fibrous calcified plaque. ما في إلا هذه واحدة من الاثنين. تمام. And this is what takes us to acute coronary syndrome, the types of acute coronary syndrome. All right. ST elevation MI is when there is a thrombus that is going to occlude the artery completely. صار في thrombus عندي. All right. قفلت the whole artery. صار complete cut of blood. This is ST elevation MI and I'm going to show you an example of this. تمام؟ عندنا شيء نسميه non-ST elevation MI. What is non-ST elevation MI? شايفين ايش الفرق ما بين هذه الصورة وهذه الصورة؟ ايش رأيكم؟ ليش هذه قلنا ST elevation وهذه قلنا non-ST elevation؟ ايش في؟ شايفين المنطقة هنا زرقاء حوالين الثرومبس. هذه الثرومبس هي السوداء. شايفين الازرق هنا؟ ترى هذا اليومن حق الارت. شايفين اليومن هنا؟
لا
ما انتم شايفين. اذا ايش الفرق بين هذه وهذه؟
كامل الاليفيتر اسهل.
Yes. There is a thrombus لكن الديفرنس انه this thrombus did not block the complete artery ولكن it is sitting there and واحدة من الاثنين يا راح تعمل necrosis of the myocardial cells or infarction وهذا اللي نسميه non-ST elevation MI. alright, or تعمل لي شيء نسميه unstable angina. إذا in non-ST elevation MI or unstable angina there is a thrombus لكن the artery is still not completely occluded. All right. لأنه if it's going to be occluded completely حيصير البيشنت عنده ST elevation MI وحيصير هنا. Right. So هنا عندنا all right unstable angina or non-ST elevation MI في thrombus sitting عاملة incomplete occlusion of the artery. طيب متى نقول إنه unstable angina ومتى نقول non-ST elevation؟ إيش اللي بيكون الفرق بينهم يا جماعة؟ هنا كاتبين non-ST elevation إيش؟ MI. هنا بس مسمينها unstable angina. معناته لما نقول هنا في MI معناته إيش؟ There is myocardial infarction. في necrosis. كيف النيكروزيس of myocardial cells يبان عندنا clinically؟ إيش نعمل؟ Which test is going to tell us if there is myocardial infarction or death or necrosis of myocardial cells? الجواب which enzyme? Which blood test?
troponin.
يا سلام عليك. Exactly. All right. So إذا إحنا عندنا if there is a thrombus occlude the artery completely هذه ST elevation MI. This is top emergency. هذا I have to go in either open the artery with a stent or give the patient thrombolytic لأنه هذا الارتري قفل خلاص. Non-ST elevation MI or unstable angina. The difference between both إنه there is in non-ST elevation MI the troponin is going to be elevated. Unstable angina, is the patient going to have elevated troponin? الجواب no. All right. So presbyteal angina, this is like a unique type of angina when there is patient is going to have retrosternal chest pain that is exertional, relieved by rest and or nitroglycerin. But the pathophysiology here is not atherosclerosis, all right? It is what we call coronary vasospasm. فهذه you read about it, and but although nowadays يعني there is a very strong correlation between endothelial dysfunction and presbyteal angina. All right, this is something that you just need to know quickly in case of you hear about it. طيب إذا unstable angina اللي هو البيشنت is going to present. قلنا هو هذا البيشنت كان يقول أنا عندي ألم في الصدر يجيني مرة في الأسبوع يجلس دقيقة دقيقتين ويخف على طول. متى هذا اللي نسميه stable angina؟ متى يصير unstable angina؟ إذا كان pain is at rest or lasting more than 20 minutes. لا دكتور الله أول الألم كان يجلس دقيقة واحدة، الآن الألم يجلس نص ساعة عندي. more severe more frequent. والله دكتور زمان الألم كان يجيني مرة في الأسبوع، الآن كل يوم بيجيني. new onset within 1 month. all right. متى بدأ يجيك الألم؟ والله معايا من شهر، من أسبوعين. any new onset angina we consider it unstable angina لأنه we want to catch that thrombus early. all right. and crescendo angina اللي هو يقول بدل ما كانت تجيني مرة في الأسبوع صارت تجيني كل يوم في الأسبوع. طيب how do you manage a patient with angina? The answer quickly it's toward the pathophysiology. إذا إحنا الآن قلنا in the pathophysiology we have toxins, we have chemicals, we have platelet, we have inflammation, and there is demand, supply, and blockage. All right. So number one, general management. So is when you have to treat anything correctable. يعني ايش؟ واحد smoker ask him to stop smoking. Obese, cut weight. All right. Anything that is correctable, you correct it. تمام. And now I'm going just to quickly focus on the medical management. All right. So how do we treat acute coronary syndrome patient with angina? We have few lines. Aspirin. When do we give aspirin? And sorry, معلش. Aspirin it is what? ايش هو الاسبرين يا جماعة؟ سمعتوا عنه؟
Antiplatelets.
ممتاز. Why we give antiplatelet therapy؟ لأنه ها؟
في تجلط.
Yes, exactly. Platelet هذه هي أسوأ شيء. هذه هي اللي they aggregate and يقفلوا لي and they produce a thrombus. ممتاز. Clopidogrel is another antiplatelet. All right, and راح نقول ليش why you need to give 2 antiplatelet. Low molecular weight heparin or unfractionated heparin. ايش هو يا جماعة؟ It is an anticoagulation. Why we give anticoagulation? جواب. To prevent thrombus. Yes, a thrombus formation. ممتاز. Lipid lowering agents, statins. Why? Lower the lipid in the circulation. Nitrates. ايش راح نعمل؟ النيتريتس what do they do to the heart? To the arteries. ممتاز. فبالتالي I improve the perfusion. More I improve perfusion, I improve oxygenation. Beta blocker. Why do I slow the heart rate? ها ايش رايكم؟
الأريثميا.
لا سيب غير الاريثمياز. patient عنده angina. Why I give them beta blocker. ممتاز.
عشان نقلل الدماء.
نقلل الدماء. أحسن. Perfect. ممتاز. Alright. Percutaneous coronary intervention. وهذا الأخير اللي أنا أبغى أوريكم هو إن شاء الله. So this is the ST elevation. Whenever you see P wave, QRS, and you see this ST segment up above the baseline, this is ST elevation. Alright. Differential diagnosis of anginal pain. Not all chest pain are anginal. Some of them from the lung, from the esophagus, the muscles, has a lot of differential diagnosis. All right, so now last thing I want to go through some cases to show you what are these people clinically going to present with. تذكروا الصورة هذه this is something which we call intravascular ultrasound. احنا ندخل with the coronary angiogram. هذا coronary angiogram. all right. هذا right coronary artery. شايفين حرف السي. احنا هذا الانبوب اللي هنا هذا هي الكاثيتر. هذا القسطرة اللي we put it in the aorta. وتنزل هنا التب حق الكاثيتر. It goes inside the right coronary, the ostium of the right coronary artery. We inject contrast, and the contrast is going to fill the artery. All right. So this letter C is the coronary artery, the right coronary artery. أبغاكم تقولوا لي هنا شايفين الكونتراست here it filled the proximal part of the right coronary artery. شايفين الديامتر هنا of the right coronary artery وهنا. ايش رايكم؟ ايش شايفين الفرق ما بين هذا وهذا؟
في narrowing.
ممتاز. اذا هنا the artery has a lot of narrowing in the proximal part. all right. كم البرسنتج؟ يعني احنا دحين لو قلنا هذا الارتري 100% is patent. هذه المنطقة تعطوه كم بنسبة كم بلوكت؟
70%.
ها؟
80%.
90% ممتاز. انتوا خلاص انتوا دحين ما صار شايلين صرتوا intervention cardiologist خلاص تشتغلوا معانا خلاص ما شاء الله you have good eyes. بالضبط. هنا الارتري البلوكج is like 90%. تمام. لما if you want to visualize this narrowing ايش نسوي؟ ندخل عندنا شيء نسميه intravascular coronary ultrasound. شايفين الصورة ذيك اللي احنا وريناها في الكرتون حق حقت اليومن، شوفوا سريعا أذكركم فيها. تذكروا هذه الصورة، more atherosclerosis واليومن صغرت هنا. ايش رايكم؟ شايفين هذه اليومن جوا ولا لا؟
ايوه
بالضبط. هذا الدائرة الصغيرة هذه الجهة الكاثيتر حق الالتراساوند. المنطقة السوداء هذه هي اليومن اللي فيها البلد. ايش المنطقة الدائرية هذه؟ هذه الدائرة الكبيرة الوول اوف ذا هارت او وول اوف ذا ارتري. طيب شايفين المنطقة هذه اللي صاير بروليفريشن كبير في المنطقة؟ شوفوا هي الآن هذا الالتراساوند ديفايس الأسود هذا كله اللي ما بين الأبيض هذا كله بلد. الارتري اليومن حقته فين؟ هذه هي اللي برا. تمام؟ ايش هذه الكتلة هذه كلها اللي هنا؟ هي نفسها الأثيروما اللي شايفينها في الكارتون. فإذا these people ايش يكون البرزنتيشن حق هذا البيشنت؟ ايش تتوقعوا؟ است elevation MI ولا انجينا؟
الآن
ممتاز بالضبط. يلا وهذا اللي أنا أبغى أوريكم هو الآن. هذا patient جاني with angina. alright. طيب خليه يعمل play كذا all the time. طيب هذه هو بالضبط الكيس اللي طيب شوفوا هنا ايش رايكم في الديامتر هذا اللي هنا؟ شوفوا هنا كيف الارتري، خلينا نقول بنسبة 100%. هنا بنسبة كم؟ مقفل؟
50
زيادة، يعني زيادة تقريبا 70-80 في هذه الحدود. اوكي. فهذا البيشنت is presenting with angina. All right, you see the lumen, the narrowing. What do you do in the cath lab? We open the artery, we dilate the narrowing, and we place stent in the artery. فبالتالي we keep the artery open. فشايفين هنا؟ شفتوا الفرق؟ شوفوا تمام. شفتوا الفرق؟ السايز كيف شايفين هنا؟ ومقارنة بالسايز كيف الناروينج كان موجود. تمام؟ alright. واضح؟
يا دكتور الأماكن الغامقة في الارتري ما تكون برضو انديكيتور؟
كيف؟ معليش أي مناطق؟
يعني في هنا في الارتري مكان أكثر سوادا من غيره.
أيوة. لا هذه صح ما شاء الله عليك، بس يعني هذه عشان بس الريزوليوشن. تمام؟ لكن المهم عندنا دائما في الكاث في القسطرة إنه we look at the narrowing, the blockage. ماشي؟ ممتاز. يلا هذه patient is presenting with angina. يلا الآن بوديكم another extreme. شوفوا هذا patient. alright. هذا الكاثيتر برضو شايفين الأنبوب هذا داخل في الليفت main coronary artery. left main coronary artery أهم برانش له شغلة تو برانش، ال LAD artery left anterior descending، وعندي left circumflex artery. تمام؟ إيش شايفين جهة ال left circumflex artery؟ شوفوا هنا ال left circumflex. شايفين يا جماعة؟ شايفين الكورة هذه كلها؟ شايفين الكورة هذه؟ هذه البوردر حق الهارت. فالارتريز لازم توصل لكل البوردر. شايفين الليفت سيركمفلكس هنا؟ هل قاعد يوصل للنهاية ولا ما يوصل للنهاية؟
لا
ما يوصل.
وقف. ممتاز ما شاء الله عليكم. موقف هنا. تمام. فإذا هذا completely blocked. What is the presentation of this patient?
هذا MI صح؟
MI
أعطونا كامل الديفينيشن نسميه إيش؟
Myocardial Infarction.
ST elevation MI اللي هو يكون عندهم complete thrombus occlusion. تمام؟ فهنا هذه هي top emergency. We have to open the artery with stents and balloon. فالآن شفتوا left circumflex artery الآن ما شاء الله فتح ووصل إلى نهاية الكورة. alright. شوفوا هنا كان موقف وهنا فاتح إلى النهاية. alright. ف this is an ST elevation MI. معناته هنا there is a complete thrombus occlusion. خلاص؟ يلا ممتاز، شكرا لكم موافقين. If you have any questions feel free to get back to me. وموافقين إن شاء الله. أنا حاولت إنه make it يعني more of a clinically oriented. يعني maybe I should have covered more items in the medications. لكن if anyone has any question تواصلوا معي privately. I welcome any questions. أي سؤال قبل ما؟
العافية دكتور.
يلا موفقين إن شاء الله. مع السلامة.